Your nervous system is often overlooked, yet it might be overwhelmed by a constant cortisol bath. Do you know what that means for your health? Well, today I'm chatting with Dr. Renee from Verve Holistic. We're going to explore how her unique chiropractic care helps your body unfold into its natural, well rested state, which means you're going to sleep better, and so will your little one. In our most sleep deprived moments, our children will teach us exactly what we need in order to learn and grow into who we were created to be. These are the loving lessons we will learn whether we were wanting to or not. I'm Irene Googe, your sleep coach, and I'm on mission to educate parents on how to help their young children sleep. Welcome to the journey. Well, hello and welcome to the Loving Lessons Learned podcast. I am super excited to have you meet Dr. Renee Schneeman. She is a family chiropractor in downtown Raleigh. She tends to see a lot of families with infants, new parents, and folks that are struggling with anxiety. But there's always space on the table for any type of person. And so she loves working with people who want to create more ease in their bodies and lives that are helping them regulate their nervous system in a gentle, specific, and honoring way. And I love that. And I do want to just share that one of the things that I learned about Dr. Renee is that she's not only from Illinois, but she was also the perfect baby. So welcome, Renee. I am hopeful that you can tell us a little bit about being this perfect baby. Because parents are,
Oh
we're
my.
always trying to figure out how do we get this perfect baby?
Well, I will say that was a quote from my mom. So to have the full story, we'd probably need to talk to her. But um, the kind of short synopsis of that is my mom had a very stressful pregnancy with me. There were two very close family members who passed away while she was pregnant with me, which meant my dad then took over the farm. So she was very stressed through that whole pregnancy. My birth was pretty intense. I was sunny side up. I had all kinds of blood in my stools and all of this stuff. It was not a perfect baby from the get-go. I had colic. I was crying a lot. I was very uncomfortable. But luckily, my parents became friends with the small town chiropractor. And we were very close with their family. And once that happened, it was a different time, right? So it was early 90s and people weren't really bringing their kids to the chiropractor. And so he would see kids for free. And so she brought me, and I think I was probably 5 or 6 months old at the time. And I had constant ear infections, tubes in my ears multiple times with no relief, still crying. And once I got adjusted and started getting regular care, it changed completely. I turned into the perfect baby. I was
I love
completely fine. I was sleeping well. I was not screaming. I was not crying. My ear infection stopped. And so that you can imagine was very life changing for my mom, especially because
yeah.
I was the fourth child. So it's not like I was just the first baby and this is all she's put her energy into. Like, so that
Uh-huh.
was a game changer for her and for
Yeah.
me, obviously.
Well,
Definitely changed the trajectory of my life. So
what
yeah.
a beautiful story. And right, like it does change your path and like what your experiences were because your nervous system started getting regulated early on. I wonder if you could talk a little bit about what that looks like for babies, because, you know, as a sleep coach and postpartum doula, I talk to families all the time about getting calm and relaxed, right? Like that's going to help us when we feel safe and secure and we're comfortable to be able to relax and actually sleep. And so, can you talk a little bit about like what happens, like maybe with birth trauma and how chiropractic care can help with that?
Yeah, absolutely. So birth trauma, as you know, is pretty common. Even if you have the most beautiful, untouched physiological birth, it's still hard to be born. And so,
I don't
when
think
baby,
people know that. I don't
yeah,
think
you know
I
that.
really I,
Yeah,
I think that's sometimes misunderstood because most people think like, oh, it wasn't so bad, you know,
yeah.
or
There
like,
is a lot of downplay of what has gone on in the birth process. I see people all the time going, oh, it wasn't that bad. I just had a second degree tear. It's not that bad. I'm like, but that's still pretty intense. Your body still went through this trauma. So yes, it's a hard process for mom and for baby. And
Mhm.
so when babies come to us, oftentimes they are in a cortisol bath. They've been stressed out from it being in utero, even like kind of like I was talking about with my mom. She had a very stressful pregnancy. So I was being developed in a very stressed out system. And so that pushing you into sympathetic nervous system is you're not going to be able to rest. You're not going to be able to heal. You're not going to be able to sleep and do all the things you need to do to develop your brain and your body properly. And so when babies come to us, what I'm doing is helping them tap back into more of that parasympathetic nervous system. And we do that through touch, we do that through movement, through breath, through sound. And it often looks like a big unwinding of a baby because there are these patterns that get lodged in their tiny little bodies while they're in there. And they hold on to that stress until someone can help them unwind it and find ease and be in that parasympathetic state. And once that happens, we usually see a big sleep, a big poop, and easier eating. So I don't know of a lot of parents of infants that aren't looking for those things.
They all
So,
want that. Those are the things we need and want in our life for sure.
exactly. So, what it really looks like is helping activate the parasympathetic nervous system a little bit more and getting kids, well, not even just kids, but all the people on my table, getting you from being in that emotional lizard brain where you're just kind of operating out of survival to being more in your prefrontal cortex, more in your logical brain, and able to take up space and feel peaceful. And like you said, feeling safe in your body, which there's the whole polyvagal theory and all of that, that's a big rabbit hole, but
Yeah.
um, safety is key. Like you can't do anything if you don't feel safe. And yeah.
Yeah, that's great, Renee. I wonder if you could speak to parents maybe and like talk to with it, like help me understand the parasympathetic and sympathetic nervous system for someone who might be new to this language. Who's like, I don't
Sure.
even know. Like, I think I did that in school. So let's like go back to fifth grade biology class. Like, what would
Yeah,
that look
yeah,
like?
totally. So your nervous system, you've got the peripheral nervous system, which is more of like your voluntary movements. And then you've got the autonomic nervous system, which does all your automatic functions. And so within this automatic functions, this autonomic nervous system, you've got parasympathetic and a sympathetic nervous system. So sympathetic nervous system is going to be in charge of fight or flight responses. If you are perceiving that you are not safe, if you're perceiving that something is going to hurt you, something's threatening you, you're going to have an increase in your cortisol, you're going to have a stress response. It'll increase your heart rate, it'll dilate your pupils, it'll get you ready for action, or it will make you freeze. And then you've got the parasympathetic nervous system. So this is more rest and digest. This is where your pupils can calm down. You get deeper breaths. You get a slowed heart rate, and you get into a calmer state of being, so that you can digest your food, you can sleep, you can process the day, and that type of thing. So we're not really meant to live in this sympathetic nervous system long term. It's meant to be a quick stress response and then return to homeostasis. And that's not happening a lot these days because we
Our
live in
culture
a
doesn't say, let's just relax, like, let's calm down.
And so that's just not the case these days. People are very stressed out. We're bombarded with blue light. We're bombarded with toxins. We're bombarded with all the junk. And so it's harder for us to access that parasympathetic nervous system. So yeah, the sympathetic is fight or flight. I feel like I'm threatened. I need to either run or attack or freeze. And then parasympathetic is I'm safe, I'm secure, I can rest, I can digest, and be where I'm at.
Yeah.
So.
I love the language that you talked about being in a cortisol bath, right? And so if we're activated, we're in this like cortisol bath the whole time. And so we're like, adrenaline is going and we're just like, go, go, go. And that's a really hard state to like relax, let go, and just sleep, especially if that's one of the goals that parents have. And I think too, like what you alluded to with feeding as well, right? Like we can't eat well and digest well if we're like tense and on edge.
So I do want to touch on that too, because yeah, I see a lot of babies that are up like this, or they've got a torticollis and those types of things. And if you are like this, are you able to eat?
I know,
No,
right? Like,
you're
no.
able to do anything. And so that's often, yeah, I see that a lot. And we're working on opening those things up and making that easier for them. And yeah, that's a
Yeah.
lot.
And I love the language you also used around like unfolding, like you're letting the baby kind of unfold and that sort of thing. And as a doula, like I try to encourage parents to like, let's lay this baby down and let them kind of unfold and unravel and do what their body kind of needs to do. And sometimes an accident, I think, as parents, we don't allow that process to happen just because we get so
Yeah.
nervous and tense because we're all like this.
Yes, that is one of the biggest things too, is like babies and children in general, they feed off of your energy. And so if
Oh,
you're like this, they're going to be like that. So that's constantly a conversation I'm having.
yes.
And I love what you said about, taking up space. That's great for so many reasons, right? That's great for brain development. That's great for everything. And you're right. We have so many options of places to put a baby that we don't put them on the floor,
Yes.
which is really like the best place for them. So there's a lot of bouncers, there's a lot of things, and I'm like, just let them be. It's usually about doing less
Mm.
than doing, is what I've found.
I saw that you said less is more. That's one of your quotes. And I was like, yes, I fully agree. And when I was doing a home daycare, I actually had like so many contraptions, right? And like, if I could go back, I would totally do it different because I was like, oh, it was just too much stuff for me to manage, one, as a parent, but two, developmentally, it wasn't what they really needed, and I think that they serve a purpose, right? Like sometimes we need a break and we can use it, but like just becoming more mindful
Yeah. Yeah.
process.
And not to, my goal is never to shame a parent for doing what
Right.
they need to do ever. Like, I don't know
Absolutely.
what it's like to be a parent. If you need to do that, please do it. Like, and also let's make sure we're doing as much as we can to give them the development that they need.
Yeah.
So,
So Renee, you mentioned a little bit about polyvagal theory, and I know that's a big rabbit hole. I wonder if you could maybe explain that to us, like fifth grade biology. Like, what does that
um,
mean? Because I think that understanding that can be huge for parents.
yeah, I admittedly am fairly new to learning about the polyvagal theory, so I may butcher it, but I'll do my best.
Yeah.
So, in terms of the like parasympathetic nervous system and all of that, so the polyvagal theory has to do with your vagus nerve. Your vagus nerve is the wandering nerve. It goes from your like brain stem, comes through your cranial bones down along here, down into your gut, and it innervates all through your gut, your heart, your lungs, all of these things. And so basically there are three branches of this vagus nerve, and it's paired. So there's one on each side and three branches on each side. And so you've got the dorsal, the ventral, and then the sympathetic. So the dorsal vagal is where you're going to have like dorsal vagal shutdown. You're not going to be engaged socially. You're going to be more in this reserved. It would be kind of similar to like the fight or flight feeling of just like dorsal. You're reserved, you're hiding, you're protecting yourself as much as possible. But instead of running away, you're frozen. You've dorsal shut down. You've completely shut down.
Yeah.
And then the ventral vagal branch is more about being open. When you're open, you can make eye contact, you can engage with people, and that makes things a little bit easier. If you're open, you're not in that protective fight or flight type of feeling. And then the sympathetic branch of the vagus nerve is more of like the fight or flight response, but then you're coming back.
Yeah.
Fight or flight and then back. And again, I may have butchered that. I am still learning about it, but from what I understand, it says a lot about how you engage with the world and how you perceive um, your environment and how you perceive how safe you are. So if you feel safe, you're going to be more in that ventral vagal tone where you can engage and be social and make eye contact. If you don't feel safe, you're going to go into some dorsal vagal shutdown and you're going to protect yourself. And yeah, we see that a lot in like low tone babies, things like that. And they just kind of shut down because they've maybe been in a cortisol bath or maybe they had a really hard birth experience. And so it's pretty wild.
Yeah.
The thing.
Well, I think it's interesting too, because one of the big things that I learned was like it touches like every part of your body. It affects everything. And when we can understand how that affects our nervous system and we can understand why we might be behaving or doing the things that we're doing, how we're engaging with our child and the people around us and our relationships. Because it made me wonder, like with the dorsal shutdown, like I wonder, is that where we sometimes gain our ill-equipped coping strategies?
Mm-hmm. Yeah.
Just as you were saying that, I was like, oh, I wonder if it's like a self-protective mode. For me, I grew up in a home with an alcoholic father, and I never realized I was exposed to like chronic trauma is what they would say, and realizing like those were the codependency patterns and habits that I was learning, which then didn't help me have a voice and feel open. So again, like I just find that kind of stuff interesting because sometimes it helps me understand like, well, why am I making the choices that I am? Like what's happening? And
Yeah.
understanding, well, who can help me with this?
Yeah. We can help you with this.
So
Yeah.
Renee, what do you say to somebody who's kind of skeptical of a chiropractor? Because sometimes they're like, well, they're just going to crack me. Like,
Yeah.
I think that
Um,
sometimes is like a myth or like a pushback that I might hear from families.
yeah, there's a lot of like there's a lot of different kind of chiropractors, so that can be a little bit tricky too. But that is a big, misconception that I get is we're just going to be popping and cracking, and especially with infants, I want to be very clear that's not what's happening.
Yeah.
um, so the type of chiropractic work that I do is I do some of the manual work where you'll hear a pop or a crack, but that popping and cracking is just a release of gas within the joint. It's not bones. It's not, people think it sounds scary. And to some people, it is scary, but it's just a release of gas. And so when you come to me in particular, I often will offer an instrument adjustment that's a little bit gentler, a little bit less scary for people who are just easing into it. And I also do a lot of soft tissue work. So I'll do more of like sustained contact and really working with the soft tissues, the fascia, the muscles to facilitate change in the nervous system because you can affect the tone of the nervous system with any tissue. It doesn't have to just be the bone. And so there's research to show that the fascia has just an astounding number of nerve receptors. So we can have a
Is
big
that kind of
influence.
like massage almost? Like, is
Sometimes
that
it can
different?
look like massage, but to me, the difference is the intention. So a
Mm,
massage, their intention, is to help the muscles and relax and stuff. My intention is to bring ease to your entire nervous system. I'm looking at,
mm.
yeah, this spot in your spine, but how is it connected to the rest of your body? Is there a whole pattern here that's showing me what's going on? And so I'm really focused more on how does this muscle affect that ligament and then that bone versus I'm just giving a massage, if that
Yeah.
gives you any clarity.
Yeah, it does. Very helpful.
And another thing that we really focus on at Verve is cranial work, and that's not very common. I was just chatting with a friend of mine the other day who's a chiropractor, and I was like, I forget that not all chiropractors are trained in cranial work. That's crazy. So,
Yeah.
um,
And I think that's a really important factor because that was one of the things that I had learned in my sleep coaching training about cranial sacral types therapies and finding the right kind of provider that offers that. And I
yeah,
was blessed to be able to work with a family, a sleep coaching family with Verve. And it was amazing to be able to kind of watch how it all unfolded and how, like, the baby was struggling with sleep, but we were unpacking a feeding issue and some of the nervous system issues. So that was kind of an interesting journey to see unfold.
yeah, I'm glad you said that too, because it usually is not just one thing, right? Like it's not just the sleep, it's
Mm-mm.
feeding, it's nursing, it's all these things that are coming together into like a perfect storm, basically. It's not
Yeah.
just one usually. So I'm glad you said that for sure.
Can you speak a little bit more to the different chiropractors and a little bit more about what it means with cranial sacral therapy? So, because you were talking about the gentle touch, like that was what really amazed me because I was like, there was no popping for this baby.
Yeah, yeah. So your typical, like, if you're going to a pain chiropractor clinic, that's where you kind of get the pop and crack feeling. But in our office, we take a lot more time with people, and we let, especially babies, we let them lead. So what it looks like with the baby is, it honestly just looks like you're holding them. I wish I had a baby doll with me, and I would show you. Um, but what we're really doing is connecting to the sacrum and connecting to the occiput and feeling the flow of the cerebrospinal fluid. We're feeling for any restriction in the joints. And then we're moving on up into the cranium and feeling how are those cranial bones moving and working together. And is that helping things flow, or is that creating dis-ease in the system and in the body? Um, so it really does look just like I'm holding a baby. Like if you look at it, it's almost like nothing's happening. And then all of a sudden they're completely, like completely relaxed. Like I said, it looks like a big unwinding. So I'll just hold different points and let them lead. If you've ever seen a baby just wake up and they do that stretch and they're winding all this stuff out, that's what it looks like. But we're just starting that process for them. We're helping them connect to where in their body there's that little bit of dis-ease, and they take it and run and they go, woo, and they unwind the whole thing and then they relax. So, um, yeah, so that is a little bit different. And then the cranial work is definitely something different that we do. So if you are looking for a chiropractor who is really focusing on like parasympathetic engagement, my keywords when you're looking for a new chiropractor would be, are they nervous system focused?
Mm.
That's hard stop right there, because a lot of you can get a mechanistic chiropractor who's more focused on musculoskeletal issues and pain and those types of things, and that's very valuable. And I'm more about what's going on with your nervous system. How is it affecting your day-to-day life and all of those things? So, um, if
That's
you
a
were
great
looking,
distinction. Thank you for
yeah,
sharing.
yeah. And the other thing would be someone who, for me in particular, I don't know if this applies to everyone, but if I'm looking for a chiropractor, I'm looking for a nervous system focused chiropractor, and I'm looking for a vitalistic chiropractor. So,
What do you mean by vitalistic? Can you talk to us about
I'm
that?
glad you asked.
Tell me in fifth grade terms. I'm like a fifth grader. One of my favorite things.
So, vitalism is the philosophy that chiropractic was really founded on. And it's so interesting that it's come to where it is. And there's a lot of disagreement within the profession, which I think is funny. But vitalism is really what chiropractic was founded on. And that is the philosophy that there is a self-aware, self-organizing, self-healing nature to all beings in the universe. So within each living being, there is an innate intelligence that is always working towards healing, always working towards 100% and like towards homeostasis and balance. And when we have issues with that is when there's interference, like stress, like hard births, like those type of things that then create dis-ease or dissonance in a harmonic system. And so the job is to restore that and get it balanced again and create that harmony again. So that's
Interesting.
kind of the philosophy that I love to operate under.
Yeah, no. But I think it's interesting your choice of words. You said dis-ease. And does that mean
Mhm.
like disease?
No, it is a lack of ease.
A lack of ease. Okay. But it's interesting because it does also create disease. Like if you allow too much stress and things like that in the body.
Exactly. It's a very common spelling in chiropractic because we don't necessarily see disease as disease. It is dis-ease in the nervous system creating symptoms, which then is a disease.
Right.
So so that is kind of it changes your perspective when you can see your problems as a dis-ease rather than a diagnosis or something along those lines. I think it gives you power back when you're like, oh, my body is always working towards 100%. My body is always working towards self-organizing and healing and homeostasis. That gives you a lot of power back versus, feeling like you need an outside something to help you.
Right.
So
And
really what the essence of chiropractic is helping remove that interference or that disease so that you can come back.
I love that. Renee, if somebody is working with you, how long would they anticipate that journey to look like? Like, what could parents expect in a
Yeah,
treatment plan?
yeah, that's a good question. It looks a little bit different for everybody, and it definitely depends on what's going on. If we're talking specifically about like infants that have just had, kind of a rough birth, Um, typically, that looks like about 2 visits a week for 4 to 6 weeks. Um, and then we'll kind of reassess. Sometimes it takes like 3 or 4 visits, and then the baby is like, I'm great. And sometimes it takes a little more than that. It really depends on what's going on with that baby, and it depends on, what's going on with the parents and how resourced they are and how much support they have. But typically, if it's a baby with like some pretty intense stuff going on, we'll do a couple times a week for 4 to 6 weeks. If it's an adult that's just coming for more like maintenance type of care, really kind of wanting to establish some wellness care, I typically start them on like once a week, and then as things progress, we'll slowly phase them out until it's like once a month. That's more of like a maintenance plan, is once a month to just kind of check in. So yeah, it's hard because it totally depends on what's going on.
The
So
answer is it always depends.
yeah,
It
there's a
depends.
yeah there's a group within chiropractic that is always like always, sometimes, maybe, never. So
Right.
that could be the answer.
Right. It's very true. So true. And with so many things, right? Because we just never know and understand what affected our nervous system. I
Yeah,
like think back to that, like, and I'm like, oh, it's been this journey as I've been going through a healing journey and so many
yeah,
layers and unfolding that happen in different seasons. And so, yeah, it's very interesting to kind of learn all that.
yeah. I love that you said that too, because these patterns are in layers, right? And we get the opportunity to dig a little deeper and find some more. And some patterns don't show up until they're fully ready to be released. So you might have something that's going on and you're like, why isn't it going away? But it still has something to teach you. And
Yes.
so it's not ready to be released yet because it's still trying to teach you something. So it's
Yes.
interesting you said.
I love that because that's like the loving lessons we learn, right? Like we don't understand that we weren't ready for that lesson yet, but right now, this is the season
Yeah.
that we're in to learn it. This is when we need to do it. Renee, I wonder if you can help me understand like how you help moms, maybe even dads too, especially after the birth, the recovery. Because I think that's sometimes one of the things that happens is that we think like it's just 6 weeks and I go back to work and then we're all good. And, I think you and I know that it really takes the body, I don't know, I think at least 2 years to recover from the birth, if we were really honest about the whole experience. But I don't know that there's enough conversation around that.
Yeah, yeah. Um, in terms of helping mom, obviously, I'm definitely adjusting her. She's been through trauma as well, having had the baby. So definitely adjusting and making sure her nervous system is nice and balanced. And then always empowering parents and meeting them where they're at and trying to give them as many resources like you and other people in the BAB network and trying to support them and give them a lot of resources like that. But the biggest thing I do for parents is adjust them and calm down their nervous system because they're stressed the heck out. They're so stressed. So a lot of the time, the most help I give to mom and dad is calming their nervous system through the adjustment and then just offering someone to listen. Like they really want to be heard, especially moms who have had a traumatic birth or that don't think they had a traumatic birth. When you sit there and you listen to their story, that is an adjustment in itself. They're just like, oh, thank you. Thank you for hearing me. So,
I think this is what
yes,
makes it different. Oh, I'm sorry.
sorry, no, I would say yes, I'm adjusting people physically with my hands and I'm doing that. But one of the biggest things I personally offer is an open heart and open ears. Like I will listen to you and I love the crap out of my patients. Like I just
Yeah.
love them so much. And so I would say that's a big thing that I offer is just support and love, unconditional love, because it's hard. It's hard out there to be a parent. So
Yeah. I
yeah.
love what you were just saying. And I think what I was going to say is that what's different about Western medicine, typical doctor visit versus chiropractic type of visit is that you're going to experience just attention, and sometimes finding a specialist or professional. I think that you and I are in unique positions where we do have this opportunity to kind of really tune into families and find the right path that might be needed. Because I think sometimes that gets lost. Like we can be very so specialized that we don't look at the whole person anymore. So I
Yeah.
love everything you said. And I love that you love your families because I love my families. And
Oh, I
it's
love them so
great to like
much.
love everybody. It's like, yes, let's love one another.
Yes, it's really a lot better when we do.
It is so good. So
Yes.
good. Well, Renee, I know that you and I could probably just keep on talking because
I know, I'm like, we could just talk all day.
we have amazing conversations always. And I'm so grateful to have gotten to know you through Build a Birth Network. And being able to connect with other professionals, especially in this postpartum space, being able to help support families, especially as their families are learning and growing. So I'm going to share your information in the show notes so people can get connected with you. Where can someone find you if they want to learn more just about Dr. Renee?
Yeah, on Instagram is usually the best place to find us. It's just Verve Holistic on Instagram, and then our website is Verve Holistic as well. I believe
Is
I
there a
might have.
story behind Verve?
I'm
I
not
guess,
sure because I'm an associate at this office, and my boss chose that name and the logo, so I'm really not sure. I don't have a great answer for that.
okay.
I want to say Verve is like something about movement and moving through things, and the owner of the practice is a dancer, so I think that is very much where that came from, but I don't know the whole story.
I feel like I've heard that story from is it Dr. Scott, right? And so she was the one I had gotten to see in the practice.
Nice.
Just kind of cool and understanding the unfolding of the body. So
Yeah. Yeah.
awesome stuff. Well, Renee, before we hop off, I want to go through the top 5 loving lessons learned. And I'm wondering if you could tell me your
Okay.
favorite product or service. What do you love out there?
Um, I would say my favorite product, I just recommend it to like most people, is some magnesium because it's great for sleep, it's great for stress, and it's pretty simple. Like I said, I like to keep it simple, and make things easier and not more complicated. So in terms of product, some simple magnesium is where I would say that. And then
Can you
my
tell us
favorite
why? I
service.
guess just because someone might listen to this and they'll be like, why magnesium?
Because it's great for stress. It's great for helping you sleep. It's great for muscle tension. It's great for um, helping you have regular bowel movements. So just all of those beautiful things. That's why I love it. And it's so simple. Like you just.
Awesome. So maybe I'll share it in the show notes if you have a favorite magnesium resource to share
Yeah,
with
yeah,
family.
absolutely.
What is
Um,
your best self-care tip?
my best self care tip, probably consistency. Just whatever it is that you are trying to implement or care for yourself with, whether it's a daily walk, whether it's breathing or yoga, just being consistent and giving yourself a lot of grace as you're working through that. So, consistent.
What is something you never thought you would do or say?
I never thought I would be working in the birth world. I definitely like did not think I would be working as a like pediatric family chiropractor, but here we are. So
You are.
it's funny how the world works.
Yeah, it's always interesting to see the path. And I am wondering, you do not have children, is that correct?
Yeah.
Yeah.
I am a very happy aunt.
A very happy aunt. Yeah. And so I just love that sometimes I think it's amazing to see how sometimes we are placed into these roles and positions. And like, again, your personal journey of how it got you here and reset you to the work that you're doing is so cool. I love that story.
Very full circle. I think it's cool.
Yeah. And so, what's one thing you want parents to really know and take away from our conversation today?
I think the biggest thing is that your your nervous system as the parent, it sets the tone for your house, for your family, for your life, um, and how you show up and your mindset is so crucial. And because you set the tone, your children will mirror what you show up with. And that is a conversation I have multiple times a day, every day, is that we need to be aware of how you're moving and how you're treating yourself and talking to yourself and how are you open, are you moving, so that your family can flow with you. So I would say that's the biggest thing. And having a huge helping of grace in that too, because it's, as new parents, it's really easy to get down on yourself with all the things that you quote unquote should be doing, right? So
I love that.
just set your tone, do the best that you can, and also just give yourself like unconditional love and grace as you're navigating, because it's a new season. It's a new season. So yeah.
Yeah, I love. Yeah, you're right. Everything that you said, it's so true. And we'll probably have to have another conversation about mirror neurons and how all this works, because I share with families too. I'm like, it's not what we do that our children are going to do. It's what we like. It's not what we say. It's what we do that they're going to
Yeah.
model. Like I can tell my kiddos like, hey, this is the right thing to do, but I obviously did not listen to my parents, and so here we are,
Yeah. Yeah,
only
exactly. Like
doing what they were doing.
exactly. If they see you doing those things, they're going to do them too. They want to be like you. That's
Yeah.
their goal. So, yeah.
Yeah. And Renee, as a business owner, what's one thing you've learned in your entrepreneurial journey?
Well, I am not a business owner. I'm the associate here, so I don't have a lot in terms of that. But I would say that creating community is really, really important. I think getting into the Build-A-Birth community was huge for me and my personal client base and things like that. So I guess creating community would be key
Yeah. Well, and
right
I'm
there.
so glad that you did and you took that step and you host these amazing meetings at Verve, so other professionals can come together and connect because we all
Mhm.
get to learn with each other. So thank you for all of your energy that you put into that.
Thank you. I'm so glad that I met you through that. That's so fun.
Yeah. Well, Renee, it has been a pleasure connecting with you, and all the information will be down in the show notes. And I'll look forward to hopefully connecting again soon and sharing more great information with our families here. Take care. Thanks for tuning into today's show. You can see all of the details and show notes below. And as you go out into your day, I hope that you'll make it your mission to be calm, confident, and rested as you lead today. Sweet dreams.